Hi, this is Yunsha Liu. Today is December 18th, 2024. I'm going to talk about the Parkinson syndrome. And this is my, okay. So this is my whiteboard. Okay, nothing coming back. All right. So, the definition of Parkinson syndrome is a group of a neurological dysfunction that had a similar signs and symptoms as the Parkinson disease. Those signs and symptoms, that include like a tremor, especially when the body is at rest. So you will see the hand is at the rest position and the hand start to shaking, or some part of the muscle is very stiff to move on the body. And other symptoms also include a kind of slow movement or very difficult to initiate a movement. And it might have, sometimes depends on the individual, sometimes it will have kind of difficult to maintain the posture's balance. And so in some of elders, it kind of easy to cause the fall down because it loses the balance of the body. And the classification. Okay, so the disease, the classification, it has broadly two kinds. The first one we call it primary. The primary Parkinson, so that's the Parkinson disease. That is either is the most common Parkinson disease is because a dopamine transporter in the brain that's kind of have a less active or kind of a decline. So that's kind of, and dopamine is a very crucial component of a protein that's kind of to ensure a smooth movement. So we're talking about like a stiffness of the tremors of the hand or tremor of the body, or very slow movement. Yeah, that's kind of a category that the human being is not able to maintain a smooth movement. So that's related to the reduce of a dopamine activity. So that's the primary of the category. It's also the most common thing of the Parkinson disease. And the secondary Parkinson disease or Parkinson syndrome, that's either related to the environment. So for example, if someone had like head injury, so post-trauma, the head injury, that can increase the risk to get a Parkinson syndrome. Or someone got exposed to some of toxicity in the environment, or even though someone taking like anti-psychotic drugs. Those drugs, the side effect, that can also increase the risk of the Parkinson syndrome. But usually if the individual stop taking that medication, and the symptom can go away. But however, for certain type of environmental toxicity, it's not reversible. Yeah. So, okay, so the next one is etiology. The etiology is the cause of the disease. And so, right now, the cause for the Parkinson syndrome is complicated. And the science study is now well defined for certain causes that can contribute to. Okay, so sorry, take another step back. The science study cannot identify all the comprehensive cause to develop the Parkinson syndrome. However, there are some common causes. Yes, some common causes. So first of all, it's kind of sitting in individual's gene. So it's kind of inherent from the family. And another etiology is the environmental, like we just talked about, like the head injury from accident or some of toxicity in the environment. And another etiology is the neurological degeneration or dysfunction process. So it's either the loss of the dopamine neurons, or sometimes it can be the protein. Some of the protein that's kind of accumulate in the brain cells, and they cannot be expelled, and so it will cause the brain cells death, and that will also kind of impact the binding of the neural binding for the dopamine, and so it will impact the smooth movement, and it will cause the Parkinson syndrome. The next one, the clinical manifestation. We mentioned that already. So briefly, it's tremor, it's slow movement, it's stiffness of the body muscle, and sometimes is kind of have hard time to maintain the balance of the body. And the diagnostic test and expected result. Okay. So for the most common Parkinson disease, the common test used to test is called the dopamine transporter scan. So it's kind of it's kind of an image study. So a type of a chemical or a radioactive binder that will be injected into the human body through the blood. So from the blood circulation, it will go to the brain. And so from the brain, the type of protein or the radioactive tracer, it can bind with the protein in certain region of the brain, and to kind of to bind the, and it's kind of to bind the dopamine neuron or dopamine protein. And so based on the binding result, we can see the test. And with person or individual that has the Parkinson syndrome, usually the test result is to show a decrease of the activity from the dopamine neurons. Yes. And so another differential diagnosis, it's called progressive supranuclear palsy. So that's kind of have something is people will start to have more episode on falling down, especially it's on the backward falling. Yeah. And sometimes in some patients, if you check their eyeball movement, and the eyeball movement has difficulty to look up or look down. Also, some people, they will, at the end of the stage, they will kind of develop into some of the cognitive decline. So and they will have difficult to speak or to swallow. Then we're talking about because of the symptoms is like slow movement, or tremors, or stiff, or fall down. So the complication that's all related to those syndromes or related to those symptoms. So yeah, the complication is if someone kind of falling down, and that's kind of can break the body, especially for elders. And some people, they can develop into like the mood disorder, either anxiety, like anxiety to fall down, or anxiety is you cannot control your body, or depressed. Yeah, because the body movement is not as good as the young age. Some people, they can develop into dementia or sleep disorder, and which is related because if you cannot rest well and during sleep, and then your mood cannot be good. So that's kind of all related. Other complication is about the automatic of the body's reaction is like related to like the blood pressure, or you have the control of your bladder, because you kind of lose some of the control function for the muscle, and so you kind of lose the control with the bladder, or even with the digestion, or the sweating, and so this is kind of the brief presentation related to the Parkinson syndrome. Thank you.